Bob was diagnosed August 9th, 2011, his 55th birthday. His doctor told him that he had a 5 centimeter by 7 centimeter tumor on his right upper lobe lung. From there, it was about a month later, I believe it was a Saturday, he had like a mini stroke, felt like a stroke. His left leg, I think it was about a month, his left leg was numb, and so we went to his doctor. The doctor sent him for a CT scan, and that's when they found the 8 tumors on his brain. They weren't that large that they knew that, I guess, radiation would.
Yeah, like if they started treatment right away, that they could probably help Dad, they could prolong what they were thinking. Because we had been told that, you know, after they found the tumors and everything, Mom and Dad told me that Dad was, I guess, estimated to live until Christmas. Like
They gave him a 1% chance to see Christmas.
To see Christmas. His big test for himself was if he couldn't drive, then he knew that he was sick. So he always pushed himself to drive, but there was those days where he couldn't drive, and there was those days he wanted me to come along to appointments just in case, you know, he felt that maybe he didn't have the strength today, but he was going to try it anyway. So I did go to a lot of appointments with Dad. I helped, you know, relay the information to Mom. Dad's really not listening. I don't blame him. So it was important that I did come back, and I feel really good that I did come back, because if I didn't, I knew that, I just know that everyone would be in a different place right now if I hadn't been able to come back and help. I think Dad would have been the 1% that they would have thought, you know. Because coming back and giving Dad, you know, just that extra push, telling him every day, you know, stay strong. Like, me and Dad never had a good relationship. Started rebuilding it before he got sick. So I think for him to see me come back and support him the way I did really helped him.
I was thinking, I can't imagine working and doing that or looking after Bob. There was no way.
Because there was lots of errands and stuff like that had to be done, you know, doctor's appointments. You know, Mom would have missed a lot of work, had a lot of half days, stuff like that.
Oh, even
just would have been way too much.
Even overnight, like once we had the hospital bed moved into the living room, basically turned the living room into a hospital room. I was sleeping on the couch, and I was up 3, 4, 5 times a night with him. I couldn't imagine having to do that and then be up at 6 o'clock and leave the house for 7 a.m. to be at work for 8:30 and work all day and then do that all over again. There's no way. So I was glad that I was on the time off for stress leave, but you know, it all worked out in the sense that I'd be there for Bob. You know.
He didn't like hospitals. Like, we knew he was going to be at home because there's no way he was going to be stuck in a hospital for the last 2, 3 weeks, 4 months, however long it was. You know, there's no way. I think we knew from the beginning that he was going to be at home. We were going to be getting in whatever we needed shipped into the house, and yeah, I think that was.
And I made the decision to contact the Palliative Care because it was like the beginning of March.
He was just so sick, he couldn't walk, he couldn't
where
use the
point came where I couldn't get him in and out of bed anymore. Yeah. And I knew that there would be more help come in with this program. I didn't expect the help that I got. It was just absolutely, like I said, once again, absolutely wonderful.
And yeah, like Dad was starting to lose like bodily functions, like couldn't use the bathroom and stuff. So, you know, all that started deeming towards having to go to the hospital, having to have a nurse take care of him. Mom made the decision to have palliative care because it's at the home. We have nurses coming in, support, you know, bed, everything that Dad needs, a commode, you know, whatever he needed. So I think it was an easy decision. I mean, it was hard, but it was easy because we knew that it was going to be at home. Like, it was always going to be into palliative care at home, never to the hospital. Yeah.
Yeah, and too, there was always the offer. If I can't handle, you know, the you know, Ruby was the social worker, and the nurses always reminded me, if this is getting too much for you, we've got a room at St. Pierre Hospital. It's palliative care, and it's like, you know, like, there's his room and here's my room.
It definitely, home care like that, personal care like that isn't easy. You know, it's rewarding at the end of it. It's rewarding knowing how well you did, and you did the best you could for the person you loved to make them comfortable and content as far as you knew. You know, it's rewarding, but it's not easy.
People stopped coming over.
Yeah. Stop calling.
Stopped calling.
Dad used to have friends come over. Mom and Dad used to have friends come over, stop by every day almost. Someone called every day just to say hi. You know, and then once Dad got diagnosed, people stopped coming around, stopped asking how we were doing. It's like everyone got scared of C word.
Yeah.
You know,
yeah,
it's
that was
like
really,
it was contagious or something. Get it off.
Yeah. Yeah, that I found that very very strange.
Everyone kind of just ran away. Dad didn't have anybody other than me and Mom. He really didn't. You know, everyone stopped.
And mind you, there was over 250 people at the
over
funeral.
Over 250 people at the funeral. You know, so it's like.
You know, and actually, when Bob was finally bedridden, I did phone his friends, and a few of them did come, you know, to see him, and you know, I basically told them that, you know, if you don't come now, you know, you probably won't be seeing Bob again. So, in the course of the month of March, you know, he did have a few of his friends from work and whatnot come over and visit him.
If we could tell friends anything, it would just don't stray away. That's the worst thing.
Years ago, I don't know how many years I've said this, but I've said this over and over again. I don't think I could ever live with a sick person. And I have, you know, done it for, you know, complete 24/7 from, you know, November until April. But even when Bob first got sick, I thought to myself, I should have never said that. I'm being punished for saying something like that, you know. And then I just, you have to do it.
You gotta do it.
And there's no way I could have, you know, turned my back on my daughter or my husband. There's no way. There's a couple of times where it was tough for me, and especially towards the end. I'd say almost like in the middle of March, I was contemplating the St. Pierre Hospital. And then no, Bob wouldn't want that. So that just, okay, you know, get up and got to do it. So it's just something within you, I guess, that just helps you through it.